So we're at Sky Lakes Medical Center, Cardiac Cath Lab, and this is Nikki. She's a nurse in the lab. She's going to take you through a standard code cart that we have at this facility.
Alright, so I'm just going to go over the outside first, and then we'll go on to the inside. At Sky Lakes, we use the Zoll. This is our defibrillator, EKG. We can look at oxygen saturations on here, the patient's CO2, and it also, this is the machine that we use to deliver any energy in the form of defibrillation, cardioversion, anything like that. This, in particular in the cath lab, we have paddles, some of them don't, and when you initiate CPR, our machines say good compressions, depress deeper, all sorts of stuff like that. Comes with EKG leads. If you're just transporting a patient, you can put these on and it will show you the rhythm on there. Or we usually have the patient hooked up to these pads, and this is what you're giving CPR through most of the time, and that's how it's analyzing it through the machine. And then it just plugs into this cable here, and then it will show you everything on the screen. There's a couple other wires back here, just how to plug in like CO2, how to measure their CO2, especially during a code, and their oxygen saturation as well. Also on the side of this we have a backboard. It's kind of easy to forget about backboards, but that's really important, especially when you initiate CPR. We have a footstool for those who are shorter. In the lab, like I said, we use the paddles as well, so we have gel on here for the paddles, just like in the movies. There's always an oxygen tank, a Sharps container, and at different facilities sometimes they will have suction, inline suction on the code carts as well, so it just depends on your facility. And then we always have an ambu bag as well. On the top we have a couple different oral airways. It's just going to depend on what your facility has and what they decide to keep on top of here. We just have a couple little things up top here.
That's a Berman airway?
It looks like an OPA, yeah.
Mm-hmm.
Yep, so that could be inserted into the oral airway just to keep their airway a little bit open. But you're probably going to, if you're needing that, you're going to go to something else probably soon.
Here you can see the different drawers, how they're labeled. And we'll go through each one individually.
Alright, so the first drawer that I opened up is our medication drawer. This comes from pharmacy, and if you break it open you have to get a new one. There's a list here of all the medications that should be in here. Everything that you're going to use in here just depends on the situation that you're dealing with. A lot of the time in the cath lab or during CPR you're using epinephrine, amiodarone. Other situations you're using atropine. Other situations you're using lidocaine. There's a couple different drips in here. So just check out whatever your facility has on hand, and most of the time they also have a list as well. This is our airway supply drawer. There's multiple different sizes of ET tubes in here, so just depending on what the physician wants, what size, all that good stuff, we've got multiple sizes in here. You have a couple yonkers in here which are used for suctioning, a couple different airway devices that help the physician manage the airway, especially if the patient isn't doing well. An ET tube securing device, a couple different things. This thing helps, you put this on the end of the ET tube, and it just kind of helps recording the CO2 that the patient is expelling. So that just depends on, everything in here is just going to depend on physician preference and your respiratory therapist that comes and helps you. Here are the blades that they'll use to intubate. So yeah, these are all of your airway supplies, and most of the time you're just handing off supplies, and the respiratory therapist and physician and whatnot are taking care of this as well.
No?
This is the syringe and needles drawer. Just has a couple of different syringe syringes that have different amounts that you can draw up in, 3 cc's, 10 cc's, different types of needles. These are filter needles, different sizes of needles. There's an arterial blood sampling kit, so if they need to get an ABG, they can do that with this. This is for an IO, an interosseous line. A lot of the time you'll see these coming from the ER or from the field if they can't get a line. And these are just more needle sets if they need to get different access. This is a 15 gauge needle.
That's for the IO, isn't it?
Yes. Yeah. So this is what it looks like.
So this is the stethoscope BP cuff drawer. Guess what's in it?
That's it. This is the IV supply drawer. So we've got a couple sets of IV tubing down here. You're going to have a ton of different sets of IV tubing at your different facilities and per whatever pumps that your facility uses. So just pay attention to what IV set you're pulling for tubing wise. A couple of 500 cc bags of saline, 1,000 bags of saline. This is a pressure bag. We can put 500 cc or this is 1,000 milliliter pressure bag. We can essentially put the fluid under pressure and instill it a lot quicker. This IV start kits, some flushes, some tourniquets, tape, and these are different IVs, but also just a different set of IVs. This is the last drawer. This is usually the suction supplies. With the COVID pandemic going on, we've got some N95 respirators, eye shields, and gowns in here as well. But in here we've got suctioning supplies, so a suction container, the tubing that it hooks up to, a yonker. This is not for deep suction. This is just for oral pharyngeal suction. A couple non-rebreathing masks, another Ambu bag down here, and then a suction regulator as well. This is super old.
But it works.
But it works. And then at your facility, you'll probably have, wherever you're working, you'll have suction hooked up to the wall, hopefully, wherever you're at.